Yeah, like.
Good morning and a very warm welcome to everyone. First and foremost, I would like to thank all of you for joining us for this very special session today. कोविड-19 या कोरोना ने पिछले 1-1.5 साल से हमारी दुनिया बदल दी है। हाल के सेकेंड वेव ने काफी नुकसान पहुंचाया है, पर इस सब से हमें हार नहीं माननी है। हमारा काम है इस बीमारी से लड़ना, और वो हम तब कर सकते हैं जब हमें इस विषय पर पूरी और सही जानकारी हो। Today, Famhealth and Scope bring to you a special session called 3M COVID Protocol. We will learn about mindfulness, meditation, and medication, and the importance of following the right protocol for treatment and management of this virus. For those who don't know, Famhealth is a health information platform where we organize sessions and discussions with top experts in medical health issues, mental health issues, and diet and fitness tips. We also organize meditation sessions, pranayam through yoga and healing. And to experience all these, you can register for free on www.famhealth.in, और आप हमारे को टाटा स्काई फैम हेल्थ चैनल नंबर 510 पर भी देख सकते हैं। Joining us today to give us all the right information that we need to know on this session is a very special, esteemed and senior expert. We have the privilege of having with us Dr. H.K. Chopra. Dr. Chopra, as most of you know, is a senior consultant cardiologist at Medanta Moolchand Heart Institute. He is also the chairman of the World Wellness Foundation and WHA, the country head of AHA, and the former national president of CSI and IAE. He has to his credit of being chief editor of top 10 textbooks of cardiology. On this very special session also, we have the privilege of having with us Ms. Soma Mandalji, who is the chairperson of the Steel Authority of India Limited and the chairperson of SCOPE. She has over 35 years of experience in the metal industry, and she has spearheaded the implementation of path-breaking marketing strategies at SAIL since 2017. She is also the member of the CII National Committee on Steel and chairperson of the CII Subcommittee on Safeguard for Tariff and Non-Tariff Barriers. I would like to invite Mr. Atul Sopti ji, Director General SCOPE, to join us in welcoming Dr. H.K. Chopra and Ms. Soma Mandalji, and to open up today's session on 3M COVID Protocol. Mr. Atul Sopti.
Thanks, Rushali, for setting the context. Once again, good morning to everyone. As Rushali mentioned, since April 2021, this has been the toughest period for all of us. We are thankful to the God that we are now seeing the light at the end of the tunnel, as the cases are now 68% from the peak. But it's still a long way to go. Issues like long COVID, potential third wave, children COVID risk, these are some of the issues which are hovering in our minds. During this period of second wave, as you know, that public sector fraternity, they have again come forward, extended their hands for their infrastructure support, hospitals, as well as providing the oxygen. A lot of work was done. While in the scope we are committed to the fraternity, we are equally dedicated to the individuals and society at large. And for this purpose, Scope and Famhealth, which is a dedicated channel to the health, as mentioned by Vrishali, we have been working very extensively together and partnered in many health-related programs. Over the past few months, we feel that there are two most important things which one needs to arm oneself. One is the accurate information, and the second is the calmness of mind to follow the safety measures and the protocols. But the irony is, the information about the pandemic and its protocol are available in fact, abundance, not less, but in abundance, and making us very difficult to differentiate opinion from the accurate information. So keeping this in view, Scope along with Famhealth, we conceived this idea, and we thought of organizing this particular program so that we are able to impart with the correct knowledge and myths can be busted with the facts. And today, as Vrishali mentioned, we have the privilege of having amongst us Dr. H.K. Chopra, one of the whom I consider one of the best knowledge house and expert in the country in the field of COVID. Today, he will bring the accurate knowledge on the table and dispel many concerns that all of us may have. He will not only guide us on the medicines, but also how to follow healthy lifestyle through cautiousness and self-consciousness. Scope is thankful to Dr. Chopra for agreeing to address the webinar today and answer the many doubts that people have towards COVID. We also have today Madam Soma Mandal, Chairperson Scope and Chairman Sale, who would motivate us all to follow the correct path to recovery. Our heartfelt thanks to Somaji for gracing today's interaction. She would be joining shortly. There is some technical issue, I understand. I request all the participants to please be candid and forthcoming with their questions so that more and more facts can be brought to the table. Thank you and stay safe. Over to Vrishali.
Dr. Chopra, I would like to welcome you to say a few words to the audience before we begin our session today.
Are we waiting for Somaji?
I think, can you hear me, please?
Yeah,
Yes,
we can
yes.
hear you.
Can I do it on the video is not on? Let me speak on audio, if you don't mind.
Sure. Please,
Yeah,
please,
sure.
please.
Thank you, sure, ma'am.
Thank you so much. Thank you. A very good morning to Dr. Chopra, the entire team there, and Mr. Sopti also. It has been good that Scope along with Dr. Chopra has been able to provide this time to give his views on the various issues, the thought process which all of us are going through regarding the COVID. The second wave since April 2021 has been extremely challenging time for all of us. The anxiety and the general gloom has been impacting us adversely, both physically and mentally. In this difficult period, the public sector fraternity has been at the forefront in supporting the nation with COVID care facilities, distribution of essential supplies, masks and sanitizers, and also being a part of the vaccination drive. In fact, public sector, that each and every public sector is going beyond the normal job and trying to do its best, what we can do to the society, to the people, when the suffering is so much, what more we can do to help the nation to fight against this deadly disease. Many PACs also have taken initiatives like the oil sector, the petroleum sector and the steel sector have taken initiatives for liquid medical oxygen, others also, and as needy partners with the government in this crisis. In fact, SAIL alone has supplied more than 85,000 tons of liquid medical oxygen. The public sector enterprise has also helped in sustaining the economy through continued production by establishing appropriate COVID-related protocols for the safety of workforce to ensure minimum risk to the health and livelihood. However, the surge of information on social media and news has made things difficult for people, as differentiating facts from myth has become a challenge. Every day we read some WhatsApp message which keeps us really tensed again. In this situation, interactive sessions on health and mindfulness are particularly needed to inform and educate people. Scope has been organizing many socially relevant programs for the well-being of the community at large from time to time. I congratulate Scope and Famhealth for collaborating to organize this important webinar for providing genuine and appropriate feedback to remove the confusion on myths related to COVID. I was particularly impressed with the topic for the seminar, which is about mindfulness, meditation, and medication. Mindfulness is the quality or state of being conscious or aware. Meditation is to look inward or to involve the spiritual self, while medication applies to the well-being of the physical self. I can summarize that this webinar is about creating awareness to strike a proper balance in the approach to the physical and spiritual aspects of our life, which is greatly influenced by the turmoil in the existing external environment. It's a privilege that Dr. Chopra, a renowned cardiologist with over 35 years of distinguished clinical experience, will address us today. I am told that Dr. Chopra has a fellowship from numerous prestigious institutions in UK and USA, has published 584 manuscripts, authored a book, A Mind-Body Capsule, has been conferred a long list of national and international awards, and headed the Indian Academy of Echocardiography, as well as the World Heart Academy and World Wellness Foundation as president. I'm sure that his session will provide valuable inputs to help all of us in making informed decisions for our health and our well-being. I request all the participants to make the most of this opportunity and participate wholeheartedly for a safer and healthier future. I wish you for the very best for a very informative and lively interaction. Thank you, everybody. Thank you, Dr. Chopra, specifically. Thank you so much.
Thank you very much, Vrishali, for your kind introduction. It's really a great pleasure and honor indeed for me to be here on the platform of Scope and Famhealth on a very special occasion today. And the occasion is very well known to you. It is a 3M COVID protocol today and tomorrow, happening for the first time in the world, where we are integrating mind, fullness, meditation, and medication. At the outset, I express my gratitude and thanks to Madam Soma Mandal, Chairperson of Scope and SAIL, for her kind words, Mr. Atul Sopti, DG Scope, for his very nice introduction during the welcome address, Asha Kapoor, who is the MD of Famhealth, Mr. S.A. Khan and his team of Scope and the team of Famhealth, and all the members of PSUs and all the members of Famhealth, and each and every one of you for giving me this opportunity to interact on a very need-based topic, and that is 3M protocol for COVID today and tomorrow. We all know that COVID pandemic is like a global tsunami, taking away many lives for the last 2 years or so. But my appeal to all of you before we really start interaction is, we should try our best not to make this COVID pandemic as a panic pandemic, anxiety pandemic, fear pandemic, chaotic pandemic, or a confusion pandemic. We should learn how to cope with it effectively with calmness, faith, and hope. I firmly believe that by calmness, we can achieve everything in life. There is a very nice Vedic expression from Upanishad. It says, in every crisis, there is uncertainty. We do not know what is going to happen. When there is uncertainty, there is no attachment. When there is no attachment, there is freedom. When we have freedom, you surrender yourself to cosmos. When we surrender ourselves to cosmos, the cosmos orchestrates dance into your feet. This is what we call as spontaneous right action. It will happen. We know that the pandemic comes and goes. Spanish flu came and gone. Cholera came and gone. Smallpox came and gone. And even the polio came and gone. This is possible today by understanding 3M mode, 3M protocol for the COVID. By first M, I mean mindfulness and mask for everyone. And second M is meditation with mass calmness. And third M is mass medication by mass vaccination. And some people will need specific medication, which I'll be discussing in next 45 minutes or so. I think Somaji very nicely expressed the meaning of the word mindfulness. Mindfulness is basically a present moment awareness, focusing on thoughts or what is happening inside us and what is happening outside us by focusing on various senses. Somaji mentioned very nicely that we have to be careful, cautious, and conscious, and focus on all the senses of speaking, listening, seeing, breathing, eating, touching, smelling, thoughts, environment within and environment outside us, and yet maintaining the attitude of gratitude. It's a very beautiful expression, Somaji. Meditation also, Somaji explained very nicely, and I would just like to say that it is a technique by which we can experience silence or calmness, which is the need of the hour. Every individual has a silence within. So when we go to this experience of silence, we can achieve the field of pure potentiality or a field of infinite possibilities. To define it further, we can say it is the process of taking you from the disturbed level of consciousness to undisturbed level of consciousness. It's just like a sea. On the top of the sea, we see the waves, which are disturbed level of consciousness. And as we go deeper down, this is the undisturbed level of consciousness. Similarly, there are 7 levels of consciousness, like waking stage, sleeping stage, and dreaming stage. They are the disturbed level of consciousness. While the undisturbed level of consciousness are Turiya, what is called soul searching, cosmic consciousness, divine consciousness, and unified consciousness. That is in the whole universe. I think if we understand this, the life is very beautiful. There are various modes of meditation. That's not the agenda today, like which we practice and we do it, like primordial sound meditation, transcendental meditation, vipassana meditation, and then transcendental meditation, Tibetan chanting, Gregorian chanting, even chakra meditation. I practice chakra meditation for the last 30 years, both morning and evening, to have peace within myself. I think we all need to do it. This is a very important need of the day by which we witness the world inside us and outside us and never victimize with any issues so that we don't have any kind of suffering. Before we really start the program, I'll request each and every one of you to keep your eyes closed for a minute or so, and I will just try to recite a Shanti mantra so that we create some kind of vibrations of calmness within us. And after that, I'll request Vishali to start the interaction on this 3M COVID protocol for interaction with each and every one of you. May I request you, please close your eyes for a minute. And I'll recite the Shanti mantra. The expressions are like this. Vagme mansi pratisthita manome vachi pratisthita avya avya moedi vedasya ma anishta satam me ma prahasya anena dhitena koratran samdadhami satam vadishyami satyam vadishyami tanmavatu tad vaktaramavtu avtu mam avtu vaktaram avtu vaktaraham om shanti shanti shanti. Thank you very much for your kind attention. May I request now Vrishali ma'am to start the proceeding of the interaction. Vrishali.
डॉक्टर चोपड़ा, थैंक यू सो मच. सबसे पहले तो मैं आपको शुक्रिया करना चाहती हूँ इतने अच्छा आपने आपकी शांति पाठ जो कराया. I think it set the tone and the agenda for our discussion today, where we talked about meditation and mindfulness. Also, especially like to thank Soma Mandal ma'am, who has given such a beautiful introduction to the chapter that we are discussing today, as well as for Dr. Chopra and Famhealth. And I would like to tell all our participants जो सब देख रहे हैं, please अपने सवाल अपने chat box पे भेजते रहिए. हमारे पास काफी सारे सवाल पहले से आ चुके हैं और हम चाहते हैं कि because डॉक्टर चोपड़ा हमारे साथ आज यहाँ मौजूद हैं, हम जितने ज्यादा सवाल ले पाएं उतना इनका यहाँ होने का फायदा लेंगे हम. Dr. Chopra, thank you once again. And getting into the discussion, you beautifully explained the entire process of the 3 M's. I want to now first begin and touch upon COVID protocols, जो एक हमारा topic है आज का. What are these protocols about COVID that we've been talking and we've been discussing and hearing on a lot of media channels, but what people like us need to really know? So do tell us about this a little bit.
Thank you, Vrishali. I think we all know about COVID by now. That the COVID was born in Wuhan, and the scenario you just heard from Mr. Atul Sopti, the scenario is almost touched up to 17 crores in the world. When in India, it is 2.7 crores. That is 16% of the world patients are in India, which is really painful. And if you see in Delhi alone, there are about 14 lakh people. That means 5% of total Indians are in Delhi. Now just focus on the mortality. The mortality is about 2.15% in the world, which is quite high from our point of view, medical point of view. And it's 1.2% in India, less as compared to the global figure. But if you see in Delhi alone, it is 1.7%, which is very high mortality. I think that's a quite concern. That's how we thought that we must have some protocol by which we can enhance the awareness to reduce the morbidity and mortality which is COVID infected. We all know by now that the COVID has been transmitted by various methods. Initially, it was thought by aerosols or by droplet infection. And now recently, the second wave, there was a lot of news that it is airborne because the new strain or the mutation, which is B1617, very highly infectious, very highly virulent, and the mortality is very high. And it has really hit the India very high, especially the young population. So, ladies and gentlemen, I'd like to give you a message that this is the only disease, COVID, in the world, which hijacks the body right from head to the toe. It is pro-inflammatory. That means it causes inflammation right from head to the toe, everywhere. It causes clotting, what we call is prothrombotic. It is immunogenic. It forms immunogenic reactions in the body. So this is the first disease which is lethal and of its kind for the first time in the world. A new disease with the new mechanisms. So that's how there is a need of the protocol. And this is such a disease that it makes the person immunodeficient, and that's how they are vulnerable to go into so-called opportunistic infection in the form of bacterial infection, fungal infection like mucormycosis, because a lot of these patients receive steroids, and that's how they need of the protocol. And in India, as we all know, we are the world capital of hypertension and diabetes and heart attacks and cancer. So we are immunologically compromised. So our adult population beyond 40 was highly vulnerable to this disease for the obvious reasons which I mentioned to you. Comorbidity is the main reason. That's how the need of protocol. Now, the symptoms of COVID are very well known to you. We have seen in the first wave, most of our individuals came with a very high fever, headaches, body aches, loss of smell and loss of taste, but not in second wave. In second wave, the loss of smell and taste is less, but the sore throat was the dominant feature. Even some people have conjunctivitis. Some patients have even rash, and some people came to us with a heart attack, brain attack, leg attack, abdominal attack, and eye attack, which was not there in the previous one, which is very painful. That's why we call this as a virulent virus, an infectious virus, and deadly virus, especially the mutation name which I mentioned to you, B1617. And there is a prediction, as suggested by Mr. Atul Sopti, that in the years to come, we will have second mutation and we'll have a third variant. And third variant, what will be the natural history, we still do not know till we get the problems, which is expected any moment. The question asked to me by Vrishali is, why protocol? And what is the protocol? Why there is a need of the protocol? The answer is, everybody should know what are the signs and symptoms we just learned. Everybody should know what are the diagnostic methods, and everybody should know how to classify these patients and then adopt and adapt it to the lifestyle and the medication. Medication should not be taken by self. Protocol and guidelines should be followed so that we can reduce the morbidity and mortality. If we take self-medication, then the mortality is going to be very high because the virus is very, very virulent. And a very important information which I would like to give you here, that the symptomatology varies because the disease has got a spectrum of 14 days. First 7 days and the last 7 days, they're very different. And first 7 days, people have prodromal symptoms, which I mentioned to you. And the second 7 days, there is a real cytokine storm and a thrombin storm, which may make your life miserable. And anybody can become a victim of such a storm. Even sudden deaths have been noted. Now, how do we classify these patients? These patients can be classified into 6 categories based on clinical picture, based on various inflammatory markers, which we use as CRP or interleukin 6, and sometimes we base serum ferritin and LDH. And third important thrombotic marker as a D-dimer, and the fourth marker is an imaging marker, and that is by HRCT chest. So these are the 4 bases by which we classify our patients as asymptomatic. 90% of patients are asymptomatic. Those who are young, they will not have any symptom except mild fever, headaches, and body ache. And you will see all the parameters are normal. What are parameters? We do oxygen saturation clinically, and we see the respiratory rate, breathing rate. If there is no breathing difficulty and your oxygen saturation is more than 94, that means, and mild fever, you are asymptomatic with COVID positive. So we will call it COVID positive asymptomatic. Then there is a mild, moderate, severe, critical, and critical with comorbidity. Now here, if I take inflammatory markers, up to 20 varies in mild. So 20 to 40, 40 to 60, 60 to 80, and beyond 80 is critical. This is our own classification based on what I have seen in the last 2 years. The highest level of normal level of CRP is 6. If it is beyond 6, it is not normal. Up to 20 is variable. Sometimes there is a stress, it may go up to 20. So that's why we say 20 to 40 is mild and beyond onwards. Similarly, interleukin 6, normal level is up to 7. If it goes by 3-fold rise, 6-fold rise, 9-fold rise, or 12-fold rise, depending on the severity of the infection. And the third one is D-dimer. Normal level of D-dimer is 0.5. If it is more than 0.5, then again 3-fold, 6-fold, 9-fold, and 12-fold rise according to the severity of the. And the most important is HRCT. Ladies and gentlemen, these investigations like CRP or interleukin or D-dimers had to be done serially. First week, second week, and subsequently also. So don't have any hitch. Don't confuse yourself. It has to be done as a protocol. Similarly, HRCT has to be done from 7th day onwards. HRCT has got various segments in the lung, and this virus called cytokine storm. When it produces cytokine or a clotting storm, you may get a patch of pneumonia or a clotting in the lung. And the only imaging technique which can pick up is by CT scan. There is no controversy. So far as X-ray is concerned, it may miss many findings. And the radiation exposure is only 3 or 4 times more than X-ray, chest or X-rays, which is nothing because it's a life-saving. So we give a diagnostic, prognostic, and therapeutic implications of this protocol. So everybody has to undergo a CT scan to know whether lung is involved or not. And again, we grade it. 0, asymptomatic. Up to 9, CT score, mild to moderate. Mild. 9 to 14 is moderate. 15 to 19 is severe. Beyond 19, all critical. When the oxygen saturation dipped down to less than 85. So when the oxygen saturation is beyond 94 is normal. If on exertion, like going to the bathroom or speaking or eating food, it comes down a little, but still more than 90 and less than 94, it is bearable and can be managed at home. But if it goes less than 89, it's a matter of concern. There we need an oxygen at home or oxygen concentrator at home. But if it goes less than 85, despite 5 liters of oxygen, which you get by the concentrator, then we should think of shifting a patient to the hospital. Or if a person's respiratory rate is more than 30, is dyspneic, is breathless, going to the bathroom, or even slightest exertion, don't take a risk of keeping such patients at home. This is very, very important. And there should not be any ambiguity in the protocol. The virus behavior should be known to each and every one of us. If you think that everything will be done by the doctor, it's not correct. 90% of things are done by the patients and the public. They have to understand. If you don't understand, we are there only to manage the emergency, but not at home. And of course, we don't visit a patient. So there is a need of so-called tele-video consultation. So I did a maximum consultation in the last 2 months, enormous, every 5 seconds. So you can imagine what kind of stress I had gone through in the last 2 months. So I think telemedical consultation is the need of the hour. First 7 days, only inflammatory markers rise and clinical picture. Last 7 days are obnoxious. You may get clotting, you may get breathlessness, you may have fall of oxygen, and you may get a high score depending on your CT scan. So these are all the protocols have to be understood, that every patient has to follow a protocol. Please don't go to any chemist shop and don't start self-medication. First 7 days, we treat our patients only by taking some painkillers or analgesics like paracetamol, or we give Meftal, or we give Dolo. Our aim is to keep the temperature less than 99. We give vitamin C to improve your immunity, vitamin D to improve your immunity, zinc to improve your immunity, and we also give some patients benefit of low oxygenation, some oxygen. Role of ivermectin, there is no data to support. We have been using ivermectin for the last 30 years as an antiparasitic drug. So there is no data to show the benefits of this drug in the beginning. No need of any Fabiflu. There is no strong data. So it has been used in some people by some patients, but the strong data is not in favor. So first 7 days are over. Then the next 7 days are very crucial and very, very important. Here comes the role of steroids. Steroid is a very useful drug because it is anti-inflammatory. So almost 99% of people need steroids. The only thing, it should be left to the specialist. The specialist should give the protocol depending on the associated comorbidity. If you give a high dose, then you're more vulnerable to get bacterial infection or fungal infection. So inappropriate use of steroids is harmful. But steroids has to be given in a proper protocol. It's a panacea. It is like a game changer once upon a time. It was a game changer. I used a lot of patients, a lot of people, even from PSUs, I've used when there are no other drugs available. It really helped individuals when I managed even at home. I have managed patient at home even up to a score of 14. More than 14, everybody has to be hospitalized. That's our strong recommendation as a protocol. Please don't stay at home. You may not get a time. There is shortage of beds, shortage of oxygen. Everything was a problem. And the third thing, which is very important, is once you go to the oxygen hospital, then in the hospital, we always make it a point to give anticoagulants. But if we ask for a firm opinion, the clotting starts from 6th to 7th day. So why not to start anticoagulant before the cytokine storm? Why should we wait when the storm is taken place and a clot is formed and then you're starting anticoagulant drugs? But the data available in the world today is after the cytokine storm or during the cytokine storm. We must start preventive. That will really help a lot of our patients. And the best anticoagulant or a blood thinner which is available in the market today is Rivaroxaban. Rivaroxaban is a drug of choice, very cost effective, which can use it. It is only those people who have a kidney failure we can't give them, or a pregnant lady, or a lactating mother we can't use, or somebody's got a mechanical or prosthetic valves we can't use it. Otherwise, it's the safest drug. The second word, please do not stop antiplatelet drugs. If you undergone angioplasty or a bypass surgery or you have a stent and you are on antiplatelet drugs, don't stop it. There's a lot of confusion on blood thinners. So no confusion on blood thinners. This is a very important part in the second half of 14 days. It should be continued. Regarding the hypertension, please continue ARBs and ACE inhibitors. Don't stop. Even statins to be continued. They are protective. They have benefits in the treatment of these patients. Third is about the oxygen. Any patient can be given oxygen at home by oximetry. By checking the oximetry, we can give it by the oxygen cylinder, by mask, or by binasal catheter, or if the requirement is more than 5 liters or 10 liters, you can give oxygen at home. I remember the patients in my hospital, we are given up to 60 liters and they are saved. I have a patient who had score of 25 by 25, 31-year-old engineer. Everybody lost hope. The fellow was known to me through somebody. We managed the patient on high flow oxygen, gave him steroids, and gave him monoclonal antibodies, 2 doses. So monoclonal antibodies are of a great role. Remdesivir may reduce the load. It's very important. And this patient had very high CRP levels, high D dimers like a storm, and had very high levels of interleukin. So we must ensure what kind of patient you are dealing with. So if we protocolize our patients, we can reduce the morbidity and mortality. A word of caution to each and every one of you. When we check the oximeter at home, please make sure that your fingers are not wet, your fingers are not dirty, and you properly use the instrument. Otherwise, it will give you a false reading. So that is a very important caution which you should know. We should not have any fear psychosis. We must have a good immunity. So I think protocolization is the need of the hour if we really want to reduce the morbidity and mortality. And we must follow the mindfulness and meditation during COVID and even after COVID. And there are a lot of questions which are coming up these days on after COVID care, I'm sure, which we'll be responding in next few minutes.
Right now, I'm being bombarded with lots of questions that are coming. We have callers who are waiting. We have a lot of text questions also. बहुत सारे आ रहे हैं. In fact, I would like to at this point just take a little break and go to other questions, and then we can continue my chat.
Sure.
We have Mr. Verma, who's the Deputy GM of IOCL, waiting to ask a question. Mr. Verma, please ask your question, sir. Mr. Deep Verma, can you hear us?
Yeah, am I audible?
Yes,
Yes,
you're audible.
absolutely.
Yeah,
go
very
ahead
good
with-
morning, Doctor. Yeah, very good morning, Dr. Chopra, and the whole team of SCOPE. It's a wonderful, wonderful day for all of us. Thank you very much for organizing such a apt webinar on during this pandemic era. Dr. Chopra, my question has 3 parts actually, very small one. That is, part 1 is what are the special care to be taken by a patient having CAD, stents in heart. The part B is how to manage post-COVID complications. And part 3, controversial too, what is the role of naturopathy, yoga, and Ayurveda in COVID management and treatment? So 3 part of my question. Yeah, over to you, Dr. Chopra.
Thank you very much. I think all the 3 components and 3 parts are very, very important. The first part is if a person has got a coronary artery disease with stent or without stent, we should continue antiplatelet drugs. They are at a high risk, as I mentioned to you, since this virus is a clotting virus, an inflammatory virus. It may cause inflammation in the blood vessels. It narrows down and make the blood more viscous and thick. So we must add anticoagulants also. You can ask me, sir, can we give anticoagulants and antiplatelets together? The answer is yes. Why not? If a person is on aspirin or clopidogrel, please add a rivaroxaban. It's very, very safe, no problems at all. The added morbidity and mortality is higher in the patients who are elderly with a comorbidity like this. So if any patient undergoes the angioplasty or stenting, he has to be more careful and should be vigilant that his blood pressure doesn't go high, his pulse does not become high, he doesn't get irregularity of the pulse, and his sugar is also under control and cholesterol is also under control. If he is also having associated hypertension, please make sure the blood pressure is controlled and don't stop any drugs. The requirement of drugs like beta blockers or calcium channel blockers or ARB and AC inhibitor also increase in patients who have undergone angioplasty or stenting during COVID. The second question which you asked is about the uh, about this
How to
role
manage
of
post-COVID? Yeah.
post-COVID. This is a very, very important question because, in fact, you'll be very happy to know that I am the first person in the world who has created a post-COVID rehabilitation program by evaluating heart and vascular flow profile. I should not say there are a lot of people from scope who have come to me and they've gone through this flow profile. What I do is I see the vascular profile, the carotid vascular profile, the peripheral arterial profile, venous profile, and a complete Doppler echo, just to see that there is no clot anywhere. Why I'm telling you? Because a lot of patients do inappropriate exercise at home after they recover. I remember a patient who came to me, he said, "Sir, my COVID is negative. I felt very happy and I went for an evening dance program and he danced till 1 o'clock in the night and next morning he was dead." I know of a patient who did a treadmill on second day and he had the same complication. You just heard day before yesterday, Mr. Bhatia, who had a COVID once upon a time, inappropriate exertion may give rise to a very high mortality and morbidity. Why I'm telling you, we should understand, in post-COVID time, they may have involvement of coronary arteries, increased vulnerability for more events. They may have a muscle involvement of the heart, what we call as myocarditis. It also affects the autonomic nervous system, cause tachycardia, and may also cause a tendency for pulmonary embolism, clotting in the lung circuit, which is more prone. So we have to be very, very careful after COVID, and we must evaluate ourselves that we are fit. And the second word of caution is every person after COVID should start a graded way of exercise, not unaccustomed exercise. High mortality, high number of patients, huge number of patients with a very high mortality because they didn't understand what kind of exercise they should do. Plenty of fluids, they should take immunoboosters and be slow in your activities. It can also cause DVT, deep vein thrombosis. I had a young guy who was 42-year-old, had a clotting in the veins. And my own data, I'm telling you, 20% of patients in the post-COVID time have clotting in the veins. So until unless I see them, how do I know who is getting clotting and who is not getting clotting? And the second question which I'd like to mention, since you asked post-COVID, everybody who is on rivaroxaban should take from 6 weeks to 8 weeks rivaroxaban as advised by the specialist. Should be given at least 10 milligram to 15 milligram to 20 milligram, depending on the comorbidity. Especially ladies who are having periods, they must give a little gap for 3 to 4 days. Sometimes they have a little more bleeding there. And those who have fissures or fistula, they may also have some bleeding tendencies. Otherwise, it is a very safe, cost-effective, and totally help in the reduction of morbidity and mortality. So COVID, cardiac mortality are known. Other things are also there. If you've got asthma or bronchitis, your lungs are affected. So you should go for a lung function evaluation. And please make sure in post-COVID time, after 6 weeks, have your CT scan. I advise 3 CT scans. First on 8th or 9th day, then after giving a full treatment in the hospital, and then on 3rd during the rehabilitation. So that we have an idea that the lung anatomy is preserved and lung functions are preserved. It is only in those who are severe cases, not in mild or moderate cases. Moderate cases, we need only 1 or 2. In mild cases, we need only 1. So it all depends on the protocol. Just go by the protocol, not by your protocol. Doctor's protocol is very important. By this, we can reduce the morbidity and mortality. Second important question which you asked me after COVID care is the cognition. Some people have a memory reduction because the blood flow is reduced to the brain vessels. They may get fatigue. They may get fever. I've seen some patients who are even getting a rise in CRP levels and fever again coming up after 2 months to 3 months. That means the inflammatory process is still there. The activity is still there. So it goes on for 3 to 4 months. This is known as, sir, what we call as systemic inflammatory syndrome. So post-COVID syndrome is a systemic inflammatory syndrome. I also call it as systemic clotting syndrome. So you have to be careful that you should not have clotting and you should not have inflammation. If at all is there, please see your doctor and go for a protocol. The protocol of cardiovascular health, which I'm going to launch very soon in my hospital as heart and vascular flow profile protocol, should be done in everybody. Some people have a kidney injury, some have a liver injury, some may even have intestinal injury. I would just like to narrate 2 patients, sir, with your permission, who is also post-COVID. They didn't bother and they attended parties in the Rotary. And one person had inflammation of the bowels and had perforation of the bowel and succumbed. Another patient also had a similar issue. They had a bowel problem, inflammation of the bladder and perforations, multiple perforations. And it is on this perforation, so-called fungi are formed, what we call the white fungus or a black fungus or a yellow fungus. So you should be aware of, this is systemic inflammatory disease right from head to the toe. So everything has to be considered. Post-COVID care is the need of the hour. COVID care is the need of the hour. Without protocol, it's not possible. The last question which you asked, sir, role of yoga and Ayurveda. I must tell you today, the definition of yoga should be known to us. Yoga means union of mind, body, and soul. When I say yoga, it does not mean only asanas. It is yama, niyama, asana, pranayam, pratihara, dharana, dhyana, and samadhi. You may get confused if you don't know Hindi. So yama means do's and don'ts. Niyama means self-discipline. Asana means various postures, which you see a lot of gurus. Don't follow them. Follow the scientific gurus. You yourself are a scientific guru. Don't follow anybody for this. You have to understand it and practice at home. And fourth one is pranayam, breathing exercises. Pratihara, contemplation. Dharana, concentration. Dhyana, meditation. And samadhi. That's what we are discussing today. And Madam Soma also addressed on this issue. And I've told you already, I'm doing chakra meditation for the last 30 years. I'm not doing just for the sake of doing it. It helps me a lot. So everybody should be in meditation mode all the time and should be in the mindfulness mode all the time. So far as the medicines are concerned of yoga, we need validation. We are scientists. We don't believe in anything without validation. They use a lot of herbs. I don't know what are the level of potassium or toxic they are for kidney patients. So we don't have data. Whatever data we have, we use those. If we have data, we don't use them. So it's a data-based. Yoga is very good. Yoga is a way of life. We all should do it. I follow a yogic life. I don't smoke, I don't drink, and I don't take non-vegetarian. So I think I don't say you should not take non-vegetarian, but I just want, if you smoke and have COVID, mortality is high, morbidity is high. And if you have excessive alcohol, again, you will fall victim to all kind of problems. But if you take non-vegetarian like fish and chicken, it's fine sometimes, but no meat, no red meat. So I think that's my message to yoga and Ayurveda and other things. But please keep on taking immunoboosters like vitamin C, D, and Z. There's some controversy about zinc. If you take too much of zinc, more mucormycosis. But I think it's very limited. If you take it very high dose for a long time, we are advocating only for 3 to 6 months. After you go through a crisis of so-called post-COVID crisis, you don't need it. And vitamin C and vitamin D is a normal requirement. So we advise you normal requirement. As the age grows, we have a lot of wear and tear in our body. So we must continue yoga for the life. I must tell you, ladies and gentlemen, today, please get a message. I do Om Bilom before breakfast every day in the morning. I do before lunch. I request you also to do it. And I do it before dinner. And I'm 70. And I work for almost 16 hours a day and write textbooks every year. You just heard the introduction from Vishal. It's all in your mind. If your mindset is strong as mindfulness, and if you work from your level of consciousness, you're going to be very happy, and we can get rid of COVID very effectively. And this will be the game changer. The game changer is mindfulness with mask for next 2 years. Meditation with mass meditation. Everybody should be calm, no aggression, and mass vaccination. These are 3 M's by which we can get rid of COVID and become COVID free. This is known as COVID eradication program. And I'm very happy that we started from here. Any other question?
Yes, Dr. Chopra, loads of questions are coming, and I'm going to now take them quickly, one after the other. We have a second caller, Antim Kumar Jaiswal, who's the DGM of NTPC. Mr. Jaiswal, if you're there, please ask your question. While we are lining him up, Dr. Chopra, I must thank you for the detailed answer that you gave. And I think COVID has made us all realize how important it is for us to keep track of our bodies. So many, for the last so many years, doctors have been talking about this. I think COVID has just given it a push that unless you really take care of your health, take care of your diet, and are into it completely, you're not going to be able to get rid of this problem very soon. So quickly, if people learn, it's going to really work. Okay, we have Mr. Antim Kumar ready and waiting to ask his question. So please go ahead, Mr. Kumar.
Good afternoon, ma'am. Good afternoon, sir. First of all, thanks to Scope for organizing such a wonderful event, and I thanks to sir. Sir, I have one question. Actually, I am COVID recovered patient. I have symptoms, first symptoms on 23rd of April. Now I am suffering from skin rashes. Initially, it was red like chickenpox. Now it is normal skin rashes. So, what is the reason and treatment of the same?
I think it's very important, as I mentioned to you, since it's a systemic inflammatory state, rash is part and parcel of it. You must see a doctor and should be given anti-inflammatory drugs. When you give anti-inflammatory drugs over a period of time, it will disappear. You need to do your CRP so that we have an idea as to what is the level of CRP, and based on that, the therapy can be discussed and rule out other causes of rash also. When the rash in post-COVID time does not mean 100% it is COVID related. You must see the specialist, and the specialist will decide is it COVID related or non-COVID related. It is known that those who are in the recovery phase of COVID, rash is one of the manifestation which has to be taken care of by the drugs advised by the specialist as anti-inflammatory drugs. It is very safe and you are not to worry much about it, and it will disappear. It won't stay for a long time.
Thank you, sir.
Okay, great. I hope that it addresses Mr. Jaiswal's question. The next caller we have is Mr. Shyam Sundar Sethi, who's the GM of Hindustan Copper. Sir, if you're standing by, please ask your question. Mr. Shyam Sundar Sethi, if you're online, please go ahead and ask your question.
Ma'am? Hello?
Yeah, sir, we
Am
can
I
hear you.
audible? Yeah. Good
Yeah,
morning. Good
absolutely.
morning, Dr. Chopra and whole Scope team. Actually, my question is, I am having anxiety resulting in very high heartbeat. Also, I am the blood pressure patient, and in the night there is no sleep, hardly 1 and 2 hours sleeping. Should I take some medicines for this? And heartbeat is around 130, 140.
Very important question you asked, sir. I mentioned many times that we should remember 7S. Number 1S
Sir.
is salt restriction. Number 2S is no saturated fat. And number 3S is we should be very, very careful about smoking We should be very careful about stress, and we should be very careful about excessive sugar. And the last 7 is very important: adequate sleep. If you are missing something somewhere, excess or deficient, you are bound to get a problem. Your question is your anxiety. This is also a post-COVID syndrome. I had a young girl who called me yesterday, 31-year-old from Lajpat Nagar, and said, "Sir, I'm very anxious after recovery from COVID. I don't get sleep and I'm getting palpitations, same as what you spoke." So all these patients, we give a little beta blockers in the form of Concor, what we call bisoprolol tablet, to reduce the heart rate, because our heart rate should never go beyond 85 or so. It may affect the heart adversely. And number two, we should have adequate sleep. There is a brain and heart axis. It liberates chemicals in the body. If there is excessive liberation of catecholamines, epinephrine and norepinephrine, it will cause palpitation. And this happens when you don't have adequate sleep. So you must sleep adequately 6 to 8 hours. Now the question is how to get sleep. Some people, they take melatonin tablets. Some they take Alprex, very safe Alprex. If one takes Alprex, they're safe, no addiction. Take it for a short while, and then gradually you start your exercise protocol. This is all because of fear, anxiety, as I mentioned to you. If you do a mindfulness and meditation every day and take some tablets for a short period of time, it will really help you, and pulse and all will be all right. Still, if I request you, since you mentioned the word, you are hypertensive, you should go to your cardiologist, get your BP checked, get your ECG done, and get your echo also done to see whether there is any event rate on the heart or not. We should try to understand what is the cause of this and treat accordingly. So you must see your cardiologist and do not keep it to yourself high heart rate or high blood pressure or anxiousness or sleeplessness. It may have an adverse effect. You should see your doctor, and they are treatable and curable. Very simple.
Thank you, sir. Thank you very much.
Thank you for joining us. We have our next
Thank
caller
you.
ready and
Thank
waiting. Mr. Rajaram Barde, who's the GM of ONGC. He's waiting for the next call. Can you ask your question, please, Mr. Barde?
Good afternoon, ma'am. Good afternoon, sir. Myself, R.R. Birthday. Actually, every day we are listening ki our near and dears are affected or something fatality is going on. So this negative thoughts and this stress level increasing. So how to avoid this negative thoughts and stress level to calm, matlab, to remain stress free?
Very difficult question, but I will give you a very simple answer.
Right.
The answer is please meditate every day. 20 minutes morning, 20 minutes evening to calm you down. Number two,
Okay,
have
sir.
mindfulness. Number three, don't have negative thoughts. Always try to wipe down the negative thoughts and change it to the positive thoughts. I know 90% of thoughts are wasteful thoughts. It's only 10% of productive thoughts. Try to change it. It is in your hands. And
But how
number
to
four,
avoid sir, these negative thoughts?
our aim is not to avoid, replace
Okay.
them with the positive. It is in your hands. And have adequate sleep and be very bold. Follow the nature. Sit in the garden. Look at the beauty of the nature. Look at the plants. Look at the galaxy. Look at the flowers. At the moment you can't go out, you can do it from home. Be busy. Keep your mind busy in positive things. If you have children or grandchildren, be with them so that your mind is not a wandering mind. Your mind is a stable mind and a conscious mind. And you go to the deeper level of silence, then you won't get negative thoughts. Negative thoughts come, that is the nature of the mind. Mind is a wandering brain in the whole body, and it causes all kind of turbulence and changes in the chemistry. So we need to stabilize it. And it is a lot of work required because somebody asked the question of yoga, the same answer, we must try to meditate every day. I already speaking to Mr. Atul Sopti before the session started, that I would really like to have a session here by Dr. Deepak Chopra, who is the world authority on promise and power of meditation. And we'll do a program for you all so that the stress can be eliminated. We all remain in a calmer mode. I'll request him, and very shortly we are going to organize a program how to face or calm ourselves from this COVID pandemic on COVID times by doing meditation, and all the techniques, methods, and the benefits of meditation can be discussed. If you meditate, the requirement of medicines are significantly reduced. Your palpitation will come down, and you'll feel yourself. You'll become a very loving man to yourself and to everybody around you. But please meditate, and no consumption of toxins like smoking, tobacco, alcohol. They have an additional value of adding more stress. And unaccustomed stress should be avoided. As I mentioned to you, like treadmill or bulwarking or going to a gym should not be done for 3 months after recovery from the COVID.
So I hope that addresses your question, Mr. Barde. Thank you for joining us today. Dr. Chopra, before going to more callers, there are some other questions which are coming and very pertinent. I'm going to read them out. Black fungus की हम बात कर रहे थे, mucormycosis जो बोलते हैं, it's rampant. We've been hearing of lots of cases and serious situations leading to even death at times. So the question is, why does it happen? Why does it occur? And what are the preventive steps for black fungus? Up to how many days are the chances of black fungus occurring after COVID recovery?
I think it's a very good question because in Delhi there is an epidemic of black fungus. On the day before yesterday, I was reading the newspaper. There are more than 1,004 cases of black fungus. In my own hospital, there are about 6 patients of black fungus with me. And those patients already took a very heavy dose of steroids outside, inappropriate, and almost 80 to 90% of them were diabetics, uncontrolled diabetics. So those who are uncontrolled diabetes and those who are taking heavy dose of steroids on the top of it, their immunity becomes low. So they may get a septicemia, what we call a bacterial infection, or a mucormycosis. Mucormycosis or a black fungus is not black in nature because the circulation is reduced in the body. It usually happens on the face. It happens on the cheek, what we call a zygomatic bone, nose, eyes, brain, and maybe in the skin, or maybe go to the intestine. This fungus is usually present in the soil and is also there in the air and also in our body in the mucus, but remains dormant. It becomes virulent and attacks us when we have uncontrolled diabetes and uncontrolled sugar or uncontrolled inappropriate dose of steroids. So the mortality of this fungus is quite high. I had one patient who was diabetic. I also gave her monoclonal antibodies. Her score was 20 by 25 and her eye became black. I had to enucleate the eye. We had to get the eye removed and debridement of the structures. But most of the patients will lose. It's only few who are treated by amphotericin B. Amphotericin B is a drug of first choice in these people. Or also, we use sometimes an oral medication also in these patients. And we give about 5 milligram per kg of body weight for about 14 days. And then they have to go for surgical debridement and they recover. The question is how early and how late, it all depends on your immunological status. So there is no definition or marker of it. Anybody who is immunodeficient is more prone to go into fungal infections. And they are not only mucormycosis, there can be aspergillosis, coccidioidomycosis, nocardiasis, all those things can happen. And the worst is mucormycosis because the mortality is very high once it goes to the brain. So you have to be careful. Second word of caution, anybody who is a high dose of steroids given by someone without understanding, it will reduce their immunity, may cause clotting in the vessels of the intestine, and may cause enteritis, diarrhea, and may also cause fungal infection there after perforation. I'd seen 2 patients who had multiple perforation with fungal infection, and they called it a white fungus. Fungus is fungus. White or black, it doesn't make any difference. So I think our answer is only very clear that please, judicious use of steroids should be avoided. And if you are diabetic, control diabetes, fungus will not attack. And if you have a high severity of COVID, beyond 20 upon 25, then you are more vulnerable because you receive high dose of steroids, or you receive monoclonal antibodies, and you receive remdesivir. So I think you're more prone. But nobody uses plasma therapy these days because this is out of protocol now. We don't use it. But I think we should use a very cautious dose of steroids and control diabetes. Then we will not delay fungal infection. We should not be any fearful. But if it is there, timely treatment is the need of the hour. Don't delay the treatment. If you delay the treatment, then the prognosis is bad.
Thank you, Dr. Chopra. एक और बहुत important सवाल है, and this after this I'm going to go back to callers, is on vaccination. We have, with God's grace, a huge population of 1.3 billion people which need to get vaccinated over the next 4 months, 6 months, whatever it takes, as quickly as possible. But there is always a question and a fear of which vaccine to take. What is the different technology being adopted while Covishield is being administered, Covaxin is being administered? Also, we are hearing about something called the mRNA technology. What is that about? And in your advice, what should it be that people need to look out for when they're taking the vaccine?
I think it's a very, very important question, Vishal. I firmly believe that there should be a mass vaccination program. You asked me a very good question, which vaccine is good? I say all vaccines are good. The only technology is different. For example, mRNA vaccine, like Pfizer vaccine or Moderna, or we use even Zydus in India is making mRNA vaccine, which is going to be launched very soon. Johnson Johnson, which is single dose in the United States, is also a mRNA vaccine. mRNA vaccines are those where the vaccines are given to an individual, not made by the virus, but they stimulate our cells to produce spike-like proteins. So when they make spike-like protein, antibodies are produced. So whenever the COVID virus attacks the human host, it needs spikes. So that takes those spikes which are already on the cells in our body, where already antibodies are produced. So the cells or the virus activity is nullified. So that's the technology which they use. But here what we use is either a live attenuated virus or a dead attenuated virus. Mechanism is same. So far as the efficacy is concerned, it varies. They mention up to 90% is the mRNA, non-mRNA is 82, 83%. But for practical purposes, all the viruses, all the vaccines are excellent. No vaccine is worse than to have a vaccine. And you should follow the vaccine, whether we get single dose and then a double dose and then a booster dose. We don't have much data about the booster dose, but only one caution is there. If you are an elderly patient, say 80s or 90s or 70s, with comorbidity like angioplasty, stenting, or bypass, or a valve replacement, and if you are on a blood thinners, please don't stop the blood thinners, because the tendency for clotting is reduced to almost 0.04%, but it's there. I saw a patient who had all kind of comorbidities. She received a second dose of injection and she had a slight clotting in the radial artery. So this is a precaution. All the elderly patients already on aspirin. I take aspirin every day. So why will not stop aspirin? Unfortunately, people stop aspirin and they stop antiplatelet drugs. So that's how they get clotting. Otherwise, they're very safe, very efficacious, and these are all available. And I'm sure my suggestion and appeal to the government of India through this platform of Scope and Famhealth is that we must import, export, manufacture vaccines, vaccines, and vaccines. and everybody should be vaccinated, boy or girl, young or old, male or female, all should be vaccinated. By vaccines, we will produce a herd immunity. People who suffered and vaccine, when we make a herd immunity, we can eradicate the virus. That's the future. If you really want to ask me what is the game changer going to be, the game changer going to be 3M. As I told you, mask, mindfulness, meditation, and mass vaccination. Vaccination is the need of the hour. Now, don't ask me Covishield or Covaxin, both are good. Choice is yours, what you want to be. I was vaccinated twice by Covishield. Now in our hospital, Covaxin is available. So people get the Covaxin. There is subtle difference. I don't think we should go to those subtle differences. It has no meaning. It is a benefit versus risk ratio. The benefit is much more than the risk. Why you bother about the risk? Every medicine you take is a risk. You take cortisone, there's a risk. You take aspirin, there's a risk. You take anything in life, there are benefits versus risk. So if there are 95% benefits, why bother about 5% risk? So I don't think there's any controversy about the vaccines. The only thing is about the lactating mother, and again on pregnant mother, they have to be a little careful. Those people who have a tendency for anaphylaxis or allergic reactions, they should take the help of a doctor. What I do, I should tell you, when I got vaccinated, I took a precaution. I took adequate amount of water, waited for half an hour. After half an hour, I took paracetamol tablet. When I reached home, I took one more paracetamol tablet. So there are no body aches, no headache, no soreness at the site of injection. And the second day also, since I am a working man, I took 2 paracetamol. No issue, no problems at all. So I advise everybody, if you take paracetamol as anti-inflammatory, because minor inflammation is bound to happen since it's a vaccine antigen, it goes to you to produce antibodies. If you take care of that, it's very, very safe, and everybody should be vaccinated, which is the need of the
Correct. So what I hear you say, Dr. Chopra, is कि vaccine लेना जरूरी है. कौन सा vaccine है उसका फर्क नहीं पड़ता, because there is a full medical team at the back end doing all the research and making sure it's available to you. So everybody who is thinking twice, please go out there, get yourself vaccinated, make sure that you've queued up and taken your appointment, etc. And now, in fact, there are lots of free camps that the government is doing. So hurry up and go out there. डॉक्टर चोपड़ा, एक क्विक सवाल ये है कि बार बार आता है लोगों के ध्यान में, अगर मुझे कोविड है, आफ्टर द फर्स्ट वैक्सीन कोविड हो गया है, मुझे कितने गैप के बाद में अपना सेकंड वैक्सीन लेना चाहिए?
So very good question. If you have a COVID positive by COVID test, RT-PCR, the specificity is 70%, sensitivity is 100%. If it is COVID antigen, we have 50% specificity. And if you have COVID negative, does not mean you don't have COVID. And third is NAT. NAT is a nucleic acid amplification test, which is a new test for COVID. You have to make sure that you have COVID. And the fourth one is the COVID antibodies. Number of times patients come to us with the pneumonia, and I do their blood test, they're COVID negative. But I see their X-ray or CT scan, they have pneumonia. So what do? I see their antibodies. If the antibodies are present, that means a patient had COVID in the past. Test is negative, but antibodies are present. So antibodies are also indirect method. But NAT is a very specific and sensitive test. Some labs in Delhi are doing. This is known as nucleic acid amplification test. But if you are positive by all the methods, vaccine should be after 3 months, not before 3 months, because you have enough antibodies. But there was one patient who came to me, very intelligent, and his antibodies were more than 250 after 4 months of vaccination. So he put me in trouble. Sir, what should I do? Should I take or should I not take? So I told him no vaccination required. When there's so many antibodies inside, why do you need a vaccination? Then he asked me booster dose. Then I told him we'll ask this question answer only when the time of booster dose comes, because they get disintegrated after 2-3 months. They won't stay for a longer time. So he lives a sunny farm, and I'm sure he'll come to me. He's a diabetic also. If he find his COVID antibodies are disintegrated, then we'll do it. Unfortunately, his daughter-in-law suffered from COVID, 28 years old. She was a ventilator for 1.5 months. She has 2 small children, 1-year-old and 2.5-year-old child. She was also put on ECMO. She could not survive. Some people even go for lung transplant because the lung injury is so much. I think that should not come. So COVID vaccination for you to understand, 3 months is the time. But if the antibodies are enormous, more than 250 or 200, you can wait and watch. So take the help of a doctor and see the antibodies, discuss with the doctor. These are known as neutralizing antibodies, anti-spike neutralizing antibodies. If the titer is high, please don't go for vaccination. If the titer is less than 150 or 200, 3 months you should wait to go for the vaccination. That's a cutoff.
We have another caller. I think the question is related to vaccinations. We have Mr. G.S. Bawa, who's the ex-GM of AAI. Mr. Bawa, if you're standing by, could you please ask your question?
I am GS Bawa. Am I audible?
Yes, sir.
Yes, sir. Please go.
Right. Thank you very much for taking the question. And I personally feel that some kind of a telepathy was working while the doctor was answering the question. And I must appreciate the efforts being done by Dr. Chopra and the team at the scope. My question is, sir, personally, a sort of a personal question which relates to my father. My father is 87 years plus, and he is an advocate by profession. And then he is into a lot of medication. Be it for some heart ailment, be it for some kind of breathing. He is on nebulizer twice every day, and then he has got other medications. And he says that he need not to be vaccinated while he is at home all the times. He says you ensure that no one comes in house who is affected, and you advise. I personally feel asking this question will be answering many other minds also. Thank you, sir.
I think it's a very, very good question, because we see a lot of patients who are coming to us after 85 or 90, they are reluctant to get vaccination because they think that vaccination may cause some clotting or some inflammation or some problem, and they may not live for a longer time. So say, why not take precautions? Nobody should visit me at home. I should be secluded in the house. I personally feel that everybody should be vaccinated. If a person has got underlying comorbidity in the form of heart medication or kidney medication or diabetes medication or stroke medication, please continue the medication. Get yourself checked before getting vaccination. This is what I do. A lot of patients come to me and I give them fitness for vaccination. If the BP is too high, I will not tell them to go for vaccination. If the tachycardia is there, pulse is irregular, and pumping action is very low, or there are clotting inside, I will not advise them. So I personally feel after 80 or 85, you must seek an opinion of a doctor whether you're fit for vaccination or not. Patient should not decide whether he's fit or he's not fit for vaccination. I give you one more example. I have a doctor patient who's 87-year-old who was under my care. He has only mild COVID. He's an army guy. And he received the first dose. He says, you have to be there because I want to live till the age of 100. So I went with him for vaccination. He come for second vaccination. Again, I went with him. And he came down after second vaccination and told, I want to be in your room in the bed for half an hour, 45 minutes to watch that everything is all right. Now this fellow has gone to America during the COVID crisis because he knew there's going to be a second wave and he never wanted to be a victim of second wave. He's a doctor. And he sends me the information from there that I am here and I want to come back to India maybe next month or July or August. But I want full proof I should not have COVID anymore. So I want your advice. Should I go for Pfizer vaccine or not? Very difficult question he asked me. So I told him, okay, let me go through the data. So I rang up CDC in America and I asked them, do you have any profile of a booster dose? Because he's my colleague, senior colleague. So he's told, sir, there is no booster dose data with us, but this medicine will be effective. So I told him, sir, you come back here in India, we'll make sure that by that time we'll import Pfizer vaccine here and we'll give you a Pfizer vaccine, because he wanted to live till the age of 100 years. He is protecting himself. So vaccine is the best way of protection. We should nurture this idea in our family members that vaccine is the need of the hour. Don't deprive yourself from vaccination. It is a must, which everybody should be done, because we want to have some kind of immunity. Otherwise, once they get COVID, then they cannot be saved at the age of 90 or 90. I hope I am clear, sir.
Mr. Baba, I hope your question was answered. I'm quickly going to take this because this is a very complicated question जो आया है query. Dr. Chopra, इसलिए मैं जल्दी से इसको squeeze in कर रही हूँ. My father, age 72, has the following complications: allergy. He has very strong allergy to certain foods like dals and pulses. If he consumes such items, he develops edema. His BP comes down and requires hospitalization. He has COPD. He's on medication and puffs. And heart related, he has undergone angioplasty several years ago and is on strong cardiac, BP and sugar medicines. So complicated case. He's asking, is it advisable to take vaccination?
I think it's a very important question. If a person has got allergic to many things, we have to be very careful. The vaccination should be done only by taking a consent from the doctor, not from the patient. The doctor should give a consent that I know this person whose IgE report is so much, eosinophil count is so much, he is fit or he is unfit. According to me, the way the case has been described to me, I won't advocate any vaccination because the risk is more. If we get allergic reaction or anaphylaxis, we will lose him. At least he's being all right without anaphylaxis. So it should be with the consultation of the doctor. That will be an ideal advice.
Okay, Dr. Chopra, thank you so much. Dr. Chopra, आपने ये क्वेश्चन हमने Mr. बाबा का लिया, उससे पहले एक बहुत pertinent बात बताई थी. We're talking about the incident of the 28-year-old girl who had COVID for more than 1.5 months and she had gone through several treatments and was on machines. Long COVID क्या इसी को कहते हैं और exactly ये क्यों होता है? इसके what is the method of getting out of it?
See, this COVID, if CT score is more than 19, you are vulnerable to go into all complications relating to the respiratory system and cardiac system in the patients. They may get pulmonary embolism, they may get a heart attack, they may get a stroke, they may get a very high level of D-dimers. Even one of my colleagues who was in the All India Institute had a very high level of D-dimers, more than 30,000. All these patients, they need a long-term ventilator because lung reserve is very poor. And those who don't recover despite all that are sometimes advised ECMO. ECMO is a support system which is given to the patients. And if still they don't improve, even by ECMO, then they go into a lung transplant. Why it happens is a question asked to me by Vishal. It happens in the individuals who have delayed the treatment, number one. Improper treatment, number two. Number three, they are compromised immunologically because of other diseases like ulcerative colitis, Crohn's disease, rheumatoid arthritis, cancer, or other associated diabetes, or many other comorbidities like kidney failure or dialysis, or have got a valve replacement, so many problems. This young girl had no comorbidity. This young girl has two small children. I saw their movie yesterday, very emotional. We lost her only because the virus was very virulent. The virus attacked her right from top to the bottom of the lungs completely. She was in a score 25 by 25. So there was no scope for recovery. Very rarely these people have scope. And these days, sometimes people think of giving a monoclonal antibodies, so-called cocktail of antibodies. But what is the data? How much of them recover? We still have to see. Even I've given a lot of patients monoclonal antibodies in my hospital. The recovery rate I found was 70%. They're huge. I'm presenting a data in my hospital next month, July meeting. So these are good, but I think in this particular case, I feel that she has low immunity and high septicemia, bacterial infection, and high count. Maybe she was given high dose of steroids. And that's the reason she went to Chennai. She went to super specialty hospital in Chennai. She had a ECMO therapy and everything, and we lost her. It was a very painful experience. A lot of young people were lost in this COVID. The second wave was worse for youngs. It was a lot of young people, they had a massive heart attack and died in the post-COVID time and during COVID time. So I think that is the catastrophe produced by the virus, which is very, very virulent. That's the reason we say need of protocolization cannot be overemphasized. We all should know. Don't treat yourself. Please go to the doctor and follow the instructions. Even if you're not able to go and doctor is not able to visit, please have a teleconsultation so that you can be given proper treatment in proper time.
डॉक्टर चोपड़ा, ये लॉन्ग कोविड की अगर बात करें तो एक बार आप रिकवर अगर जब कर जाते हैं तो उसके बाद में क्या एक्स्ट्रा आपको प्रोटोकॉल्स लेने पड़ते हैं पोस्ट द कोविड रिकवरी, बिकॉज इट्स टेकन लॉन्गर देन नॉर्मल कोविड टू रिकवर. एंड यू मेंशन्ड अर्लियर, राइट, प्रोग्राम में बताया कि कोविड से रिकवरी के बाद भी HRCT, डी डाइमर टेस्ट वगैरह करते रहना पड़ेगा. तो उसका कितने बारी, what is the duration, how much time do you need to keep doing these tests?
Well, that's a good question. Only 10% of patients who become a so-called COVID crippled, and they are COVID crippled because of the lung involvement or a heart involvement, they need a weekly follow-up. And they should have a very weekly follow-up. Based on that, we do ABG, their oximetry, their lung function test, their HRCT, inflammatory markers, and then take a call as to how we can adjust the medication. Some of them are even on a support system for a BiPAP, or they need a lung support. So I think they are the very, very critical occasions, and I think we need the total follow-up of this protocol to the doctors, because patients, attendants may not even know the extent of involvement, but the doctor, whatever he or she decides, should follow in the role of immunosuppressive treatment or in the form of ventilator support, and how they should be followed up by cardiologist or pulmonologist. A task force is required where we need a cardiologist, a physician, and a respiratory specialist, and an intensivist. They all should create a protocol. If there's a kidney involvement, we should involve a nephrologist. If a neurological involvement, we should involve a neurologist. Task force is required, and the team force required the consensus of the treatment in the benefit of the patient.
Dr. Chopra, if I can come to, we've been also hearing a lot of conversations about third wave. Second wave is not completely over yet. I mean, yes, it is good to see that the cases have gone down tremendously, and there seems to be a positive reinforcement from the earth. But third wave is likely to happen. We've also heard about the fact that children are likely to get affected. So what are we actually looking towards, and what kind of precautions should parents take with children?
So I think it's a very important question, because we have to prepare ourselves now for the third wave. And the expectation is third wave may be in August or September. And the new mutation is called double mutation. When two viruses, they mutate and they join together, they create a third variant. And third variant will come. And the prediction is it will affect more children. So we should be geared up with the PICU, MICU, neonatal ICUs, and pediatric ICUs. Pediatric care, pediatric support system should be boosted up. We have learned a lot over the last 2 years now, 1.5 years, and we should try to make sure that all the medications are available. Timely hospitalization and timely home isolation is the need of the hour. And we must make sure that our children, grandchildren, they take all precautions. And we must ensure that immediate vaccination should start in children before the second wave, third wave, so that we save our children. At least those who get COVID, they'll get a mild COVID. So that's why I'm telling you repeatedly that the need of vaccination cannot be overemphasized. We should be very fast, and we must make sure that our children get adequate vitamin C and D and zinc, so that they have good immunity, and they should be taught, because they are all the time at home. Mentally, I mean, they are not so alert. Mentally, they are a little obsolete because of no schooling, but they should be kept busy. If they are mentally and physically healthy, I'm sure we'll do it. But the hospital should be geared up, pediatricians should be geared up, intensivists should be geared up, and we should have adequate supply of oxygen. There should not be deficiency of oxygen, because oxygen support is the need of the hour for children to save their lives. And there should be adequate supply of antibiotics and adequate supply of fluids and adequate vaccination. So we should be thoroughly prepared to fight with COVID if the third wave arises. And I think we'll be able to do it. That's what I think.
Thank you so much, Dr. Chopra. Also, I think it's important to tell and give out a message like Dr. Chopra has been saying and all other experts have been saying. In spite of all of these and the vaccinations available, the best and safest and best precaution is masking and going out in public areas only when it is extremely urgent. Otherwise, COVID has not gone out of our lives yet. We need to be mindful of that. We need to understand that we are going to help ourselves the most than anything else. Dr. Chopra, we have another caller. We have Mr. Debayan Sarkar, who's the Assistant Manager of CRWC, who wants to ask a question. Mr. Sarkar, if you're standing by, please ask your question.
Yes, good afternoon, madam. Good afternoon, sir. Myself, Debayan Sarkar. Actually, I had COVID on mid of April. I was admitted in the hospital for 16 days. I have come home after that. I was on medication, but last 5-6 days before, I have developed slight fever around 100, 100.5, and I have some dry cough. So I have to again visit a doctor, and he asked me to go for various tests, pathological tests, where I have done X-ray, where in X-ray report, it has mentioned that ill-defined opposite is right perihelial region ineffective, and done some blood test like CRP, ESR. My CRP is at present 11.53, ESR is 46, and D-dimer is 421.41. But my during the COVID days and still now, my heartbeat pulse rate is a little bit high, around 92, varies 90 to 130. So my question is there any need of doing ECG, or is there any complication on heart? And is there any warning sign for me? Because post-COVID, after nearly 1.5 months, still I have some fever and dry cough.
Yes, sir. I already mentioned to you, sir, you are suffering from what we call a systemic inflammatory syndrome. This is a very common, as I mentioned to you, to 3 to 4 months after recovery from the COVID. And you have given us the information that you got a mild COVID-like symptoms in the form of mildly raised D-dimer, mildly raised CRP, and some new lesions in the lung. So you have to be treated for this inflammatory pathology to that extent, so that the inflammation is reduced. By reduction of inflammation, if the pulse rate is still fast, I will personally advise as a cardiologist, you should get your ECG done. I'm sure you might be in 50s or 60s. You should have an ECG.
40.
Yeah, you're 40. You should have an ECG. Yeah, you are 40. You should have an ECG, and you should have an echo test just to see that everything is all right with your heart, and give you some medication like beta blockers to reduce the heart rate and take care of the inflammation. That will be the line of treatment which we will follow. You are not to worry, but don't ignore
my
also.
Doctor has, excuse me, sir. My doctor has given Eliquis 2.5, and at present Eliquis 2.5, Mucinex 600, and Joseph 500. I am going.
Yeah, I think there's a little debate about Eliquis versus Rivaroxaban. Eliquis is what we call Apixaban. But we recommend rivaroxaban 10 milligram because the data in the world is available more with rivaroxaban. So we give rivaroxaban 10 milligram to everybody to be continued for 6 weeks, and we find the results are very good. And number two, these people like yours should be given a beta blocker. So we are taking care of blood thinner, taking care of your heart rate, and taking care of your inflammation by giving a anti-inflammatory drugs in the form of low dose of steroids and in the form of analgesics. And very shortly, you're going to be all right. But we should assess that there is no organic damage in the heart. And subsequently, we should be followed up meticulously so that you don't fall victim to so-called post-COVID syndrome, which varies from person to person depending on the immunological status. Enhance your immunity and take care of it. And the anticoagulants are excellent idea. You should be given anticoagulants for 6 weeks, and then anti-inflammatory drug and immunoboosters, and go for a checkup to your specialist so that everything is taken care of meticulously in a protocolized manner, not in a haphazard manner. You take it for 1 week, then stop it. After 2 days, no, please. We have to be protocolized. That's the purpose. The COVID has taught us how to protocolize. Everything should be drug, should be recorded, should be in type, no handwritten, no confusion. Everything should be recorded. First prescription, second prescription, third prescription, and fourth prescription. Similarly, all the data should also be recorded. So then we can compare serially as to graph is going down or graph is going up. So I think if you protocolize it, your recovery rate is going to be 100%. You'll be all right. No cause of worry. Okay.
And for any specific queries, I think you should get in touch with his doctor and take his test there. We have another caller waiting, standing by. Rekha Pandey is with us. Rekha ma'am, if you're around, please ask your question. Rekha ji, are you on the call? Rekha Pandey, Senior Manager, Central Coalfields is if you're on the call, ma'am, please ask your question. If you can unmute your mic, ma'am, before you ask your question, we won't be able
Hello,
to.
good afternoon. Good afternoon, sir. I am audible now.
Yeah, you are audible.
I express my humble gratitude towards Hope and Atul Sotri, sir, and Doctor, sir, that we are able to interact with you directly. I have one question. What, as a layman, whether taking steam in any way leads to fungal infection? What we have a doubt that taking a regular steam will lead to thin our nose filter or whatsoever, and so we have a fungal infection. One. Second question is, after how many days of second dose of Covishield, I can feel confident that I have sufficient antibody to fight new variant. And third, as a mother, I have that, shall I start vitamin C, D, zinc to my child who is now 14 years? Thank you, sir.
The first question is about tea. There is no
Steam.
relationship with the fungal. Tea, there is no
Okay.
relationship. You can take tea, there is no problem, no fungal relationship at all. Tea,
No, not
coffee.
tea, sir, steam. Sir, steam, bhap. Steam, sir. Steam.
Steam.
Yes,
Steam,
sir.
excellent. Very good question you asked. I am taking
Yes, sir.
steam for last 2 years every day. The only question is, you should be very careful about the protocol of steam. Don't take steam with the eyes open. Otherwise, you may get burned in the mucous membrane. You should take a very mild level of steam for a very short period of time so your nose is not congested. And you should have a towel around you, cover your eyes when you take steam. Steam will eliminate bacterial infection or correction of mucus in the nose. It is very, very safe. Because it's hot, so there is no question of any fungal infection here. There is no relationship. The second question which you asked me about the children, how to protect, how much you should protect them by zinc or vitamin C and vitamin D. Why not? If it's 14-year-old child, you should give it to them so that they will be bursting effect. And the third question you asked me about the vaccine. Vaccine, no? antibodies?
After how much time after Covishield will she feel safe? She wants to know how long
Yeah,
after the
I
second
think
vaccine.
the data which is available till date to us is 6 months to 8 months are very safe after the second dose. And I learned only yesterday by study from Lucknow. They say the antibodies can be there up to 10 months. So if we believe the overall data, the global data is 6 months to 8 months. But one doctor from Lucknow has shown data, and I published the paper only yesterday. I got it on my internet up to 10 months. But ideal recommendation should be we must have a booster dose at 6 months to 8 months. Okay.
Haji, I hope that addresses your question. Thank you so much for asking it, and I'm coming here on the show today. Dr. Chopra, एक सवाल जो काफी suddenly last 2-3 दिन में मीडिया का attention भी बहुत आया. We heard of a case where a young gentleman, age of 48, very well established and distinguished person, passed away almost 6 to 8 months after having COVID. And they said that he was majorly into his exercise and heavily into getting back into shape, etc., etc. तो सवाल हमारा ये उठता है कि कोविड होने के कितने समय बाद आप अपने एक्सरसाइज और हेवी एक्टिविटीज रिज्यूम कर सकते हैं. And we keep hearing about graded manner. What does that actually mean?
I think it's a very important question. I know what Mr. Bhatia you're talking of. He was a very good friend. He was a class fellow of my Samdi, my daughter's father-in-law. They were together in modern school. Very bright, very intelligent hotelier by Bird's Group. And he grew very well. He did very well, very intelligent. I was talking to somebody from Lodi Hotel yesterday, the GM. He was also appreciating him. I feel when a person is in post-COVID time, he should manage his stress well. He should be more disciplined. Adequate rest, as I mentioned to you. And all these people who are high hoteliers, highly ambitious, they go till late night, they drink, dance, smoke, alcohol. They should not do it. As I told you, one of my patients whose COVID was negative, so he went for a dance meeting. They went all the way to Shimla and he danced till 1 o'clock. Next day he was dead. Very painful. So here it's coming after 6 months or 7 months. The body signal is teaching is even post-COVID, you have to be disciplined. I don't say for 6 months, forever. If you are disciplined for life, life will be good for you. Because your blood vessels have been touched by the virus. Your clotting system has been touched by the virus. You should preserve the flow and preserve the integrity of your endothelium by a good lifestyle. Because the stress also has the same negative influence. If you do that, then life will be very good. So I personally, you asked a good question, graded manner is what? When I say you recovered, you don't start doing treadmill after next day or after 1 week. No, not for 3 months. Don't go for bulwarking or weightlifting or push-ups. I think is go for a walk, not for jogging. Jogging, you will get a sudden death. So you have to be very careful what to do. One thing is very important. Sometimes people are a little scared of asking me, but since you asked me a question, one should be very careful about the sex also in the post-COVID time. Because exercise and sexercise are synonymous. They feel complex. They don't feel asked. They feel shamed. It's not a question of shame. It's a sexercise. It also enhances your pulse rate, enhances your blood pressure. Please seek the opinion of a doctor. If you have a comorbidity, you should be very, very careful. If you don't have a comorbidity, at least take 2 to 3 months to recover completely so that your CRP is normal, your D diamonds are normal, and all the inflammatory markers are normal, and radiologically also you are normal. Then one can go for normal activities. But these questions should be asked to the doctor, irrespective whether you are male or you are a female. They are very, very important, and we should not have any kind of feeling that I should not ask these questions. They are personal. There's nothing like personal in front of a doctor. You just need to ask and share before you come across any morbidity or unexpected, untimely, whatever.
I agree with you, Dr. Chopra. No question is silly or small or not warranted. If it's about your life, you need to ask all the right questions. डॉक्टर चोपड़ा, एक छोटा सा सवाल इसी के रिगार्डिंग और है बिफोर आई गो टू द नेक्स्ट कॉलर, इज दैट ये जो डी डाइमर टेस्ट है और एंटीकोएगुलेंट्स का क्लॉटिंग से to remove the clotting or reduce the clotting, etc. How much time do you need to take these anticoagulants, and would you then consider कि अच्छा वो 4-5 weeks के बाद में हम clotting free हैं?
Normally, the recommendation is worldwide data is 42 days. But I say 42 days are those who are COVID. But those who have comorbidity underlying, I'll recommend them for 3 months. This is my recommendation. And the recommendation can extend depending on the degree of comorbidity. You asked a very pertinent question. If despite all these patients, D-dimer level is high, please extend it. So there is no hard and fast rule or cut-off point. No, after 42 days. No. Based on the data. So it's all variable. And I think antithrombotic dose is also variable. Duration is also variable depending on the underlying comorbidity and underlying markers. If the markers are showing high levels of D-dimer, please continue anticoagulants for a longer time. If you are young, for a longer time. If you are old, beyond 80 or 90, so then you should not bleed. You can give it for such a period. But if you have comorbidities, then I think the dose should be decided by the doctor as to how long you should take. That's why I say protocol should be followed. If you don't get your D-dimers, you don't go to check up for a doctor, then how will you know whether you're prothrombotic or not? So that's why I'm saying protocol should be followed. Go for your heart and vascular checkup. I personally feel there is a tremendous need of heart and vascular profile check after COVID, which we are going to push it very hard, very shortly. Because especially we learned after the second stormy course of the COVID, because we lost a lot of young people. So this is how we are all learning and protocolizing so that we reduce the morbidity and mortality.
Thank you so much, Dr. Chopra. We have our last caller, Vikas Gupta, AGM EIL, is standing by to ask his question. Mr. Gupta, please go ahead. Mr. Vikas Gupta, if you can, yeah, can you hear us? Mr. Vikas
Hello?
Gupta, AGM EIL.
Can you, can you hear me? Yeah, good afternoon,
We
sir.
can.
I'm Vikas Gupta, Assistant General Manager, Engineers India Limited. I ask you a very generic question. Lot of deaths have taken place among our close relatives, among our colleagues, among our friends. And all of us, I'm sure, are going through this. In fact, in the morning itself, I attended a Shok Sabha of my very close relative. How do we cope up with the stress? We as the third party who lost our friends, our colleagues, and what are the steps we should take? Because I find we are also coming under stress of somebody going away.
That's what I think, sir, we are discussing for last almost 60 minutes, that you must have mindfulness, meditation, a regular exercise protocol, and don't get affected by any kind of stress, but manage your stress better. Sleep adequately, 6 to 8 hours, have a regular exercise, take immunoboosters, and don't fall victim to any stress. Take all precautions. If I know my own nephew passed away, who was 38-year-old, his 2 children. I give you the example of one of my patients whose daughter-in-law passed away. So we are not victimizing ourselves. We should witness all these things. It is not your fault. So you have to keep yourself in balance. That's why I think Somaji very nicely expressed, and same way Atulji expressed very nicely, that we must have a mindfulness mind, mindfulness breathing, mindfulness eating pattern, mindfulness listening, and mindfulness seeing everything. If you are mindful everywhere, you will be cautious, careful, and conscious, and you will not fall victim to any kind of stress you come across. This is just a minor stress. There are people who are on the war field what kind of stress they face. They get all kind of palpitation because of fear, psychosis. So they are also taught how to release the epinephrine and norepinephrine proportionately, not unproportionately. So this happens over a period of time. And we all have to learn. It is not one day effort. Every day we should keep on doing our regular protocols of exercise and follow yoga and meditation, and things will be fine. And just see everything is happening and witness it. And I'm sure very shortly a solution will come and we'll get rid of this problem from this planet.
Dr. Chopra, we've had an excellent session with you, and I don't know what topic we haven't touched upon. I'm sure individually many callers, many questions are still pending in people's minds, and we are more than happy. We will be sending out forms. If anybody has more questions, please do send those to us in any format. Send it to Scope, and Scope can share it with us, and we will have Dr. Chopra answer as many as possible. So thank you so much.
I'll just like to give a final message, Vrishali. And the message is, we all should know that oxygen is life and life is oxygen. Don't bother about the oxygen when you fall sick to the COVID. Go to the park and inhale the oxygen. And breathing exercise like pranayam is the oxygen inhale. Number two, don't make this pandemic as a panic pandemic, as I mentioned to you. And number three is, time to protocolize is now, before it is too late. And number four, we must enhance the awareness. Mr. Sopti is here and Madam Soma is also here. Enhance the awareness through the platform of Scope and Famhealth on cytokine storm and clot storm. It is not only cytokine, inflammatory response, but clot storm. We should do it. Some kind of booklet, some kind of pamphlets, some kind of display in digital media should be done. I personally feel that there should be a Scope and Famhealth COVID warrior group. If you create a group like COVID warrior, I'm sure Somaji and Atulji, it will enhance the huge information to the whole world that something started by Scope and Famhealth. We must take up this project till we get rid of this virus. Timely isolation, timely hospitalization is the need of the hour. We must enhance the awareness. Unfortunately, I saw many patients from many organizations who were not aware of anything. So ignorance is no bliss. Ignorance is no excuse. And innocence is also no excuse. The next thing which I really wanted is, we must understand the concept of blood thinners. There is a lot of confusion. They don't know for how long, which to be taken. We should eliminate this kind of confusion. In fact, I'm going to have a TV program very shortly. I'll request Atulji or Somaji to join me to talk on myth and realities about the blood thinners during COVID and post-COVID time. We must also enhance understanding on severity of COVID. People think COVID means stay at home. No. Severity has to be understood. And I was very happy that Atul Sopti praised me a lot in the last video. This was the best understanding I had. Mild, moderate, severe, critically. I think that's what we all have to understand. If we understand that, then we can save many lives. And third thing is, practice of 3M is a must. This point also I discussed with Mr. Sopti and he agreed that we must brand Scope and Famhealth for launching this program of 3M COVID protocol. We must adopt and adapt to the COVID lifestyle in the years to come. We cannot get rid of it. We have to learn to live with it. We have to put on a mask, whether we go into a wedding or a birthday party or any meeting with Atul Sopti or with Somaji. If I have to meet them, I must put on a mask. I can have a lunch with Atul Sopti, but that is the only time I should take out the mask. Otherwise, I must put on the mask. The mask discipline is a must. And the second thing is, we must appeal to every member of PSU, whether it's Indian Oil or NTPC or SAIL, please extend a helping hand. Provide oxygen generators, oxygen concentrator, awareness, education, knowledge. Some kind of portal should be created under the banner of Scope and Famhealth, so that anybody can download the information. In the last, I must say, we must inform, perform, reform, and transform the whole world, whole universe as COVID-free. It is possible only if we embark on the 3M protocol enhancement. Not that it should be one-time effort and you forget about it. Then we will not achieve anything. We need to work on it regularly. And I must say, my final message is that mindfulness and mask for all is a must. And the second message is meditation, very nicely explained by Somaji also, is a must. And I already discussed with Atul Sopti. Very shortly, we are going to have the program with a world authority on meditation, whose name is in every book, on every Zoom or everywhere you see Deepak Chopra. I'll try my best to get him this program. And last and not the least, mass vaccination program for PSUs and through PSUs for others as a community project. These 3M will be the game changer and get rid of our COVID from the planet soon and produce herd immunity. In the last, ladies and gentlemen, I must just say a few words from the very important Vedic expression before I hand over the mic to Mr. Atul Sopri for his remarks. And these are expressions like this. We are what our deep driving desires are. As is our desire, so is our will. And as is our will, so is our intent. And as is our intent, so is our deed or our karma. And as is our deed or our karma, so is our destiny. We are all the makers of our own destiny. We all have to go through this. Pandemic or endemic or epidemic is a part and parcel of the life. We should not be scared of it. We have only faced many for last century. We'll face this also, and this will also disappear. Thank you very much for your kind attention. I'm very grateful to Sopti Sir, Somaji, and each and everyone for giving me this honor and opportunity to be with you. Thank you.
Mr. Atul Sopti, please, if you can conclude.
Okay, thank you, Rishali. Dr. Chopra, I mean, it's always mesmerizing to listen to you. Any of your video, any program interaction with you, whenever I talk to you or listen to you, always my learning has enhanced multifold. And today's session was a riveting, great session. I have attended so many programs or listened to so many videos, but I can say that this is, I think many of us will agree, Somaji will also agree that this is one of the best session we would have ever attended or participated. And participants would also share, already I am getting a lot of messages about the program. Great. Thank you very much. And I'm sorry that we have not been able to take many callers and questions because of the time. Because already time is going 1 o'clock and this is a lunch time. I was told 50 callers were already in pipeline. Who wanted to join. And in addition to that, so many questions. I'm sorry that we are not able to take all the questions as well as the callers, but nevertheless, we'll see that how to address these particular points. What conclusion has already been, explained by Dr. Chopra, but just 3-4 points which I can pick up. First message he has given is that vaccinate. So vaccination is the only remedy. Whatsoever age group you are, not only get vaccinated yourself, but to your nears and dears also, your domestic helps also, anybody and everybody needs to get vaccinated. Second point which I could pick up is the COVID appropriate behavior. Although we may feel that it has gone down, but we need to follow the COVID appropriate behavior like mask has to be there, social distancing has to be there. We should avoid going to unnecessarily crowded places. And even if we are vaccinated or have developed the antibodies. So this is a very, very important message he has given. Third message, which is the most important message, is we need to be vigilant and intelligent. And we should, that's very, very important. And for that, protocolization is the most important thing which we need to know also, and we need to follow also. And we should not, I mean, we should listen to the expert, not follow the WhatsApp factory or the opinion makers. That's very important thing. And the self-medication should be avoided, as Dr. Chopra mentioned, and trust your doctor. That's very important thing. Trust your doctor. And in this regard, I would request Dr. Chopra that he can help us in creating the network of the eminent and knowledgeable doctors who can be accessed through video conferencing, so that right advice can be given on the right time. Of course, I'm sure Dr. Chopra, although he is very busy all the time, he will always be available to guide us and the public sector fraternity in this regard. I mean, because as he mentioned, that the future is going to be only this tele video conferencing. I mean, going personally will give way for this. So Dr. Chopra will bank on you for this thing. Thanks to you, Dr. Chopra, for agreeing to our request for approaching Dr. Chopra, who will be taking the classes on, who will be taking some session on the meditation. I mean, that will be, I'm sure, lakhs and lakhs of people would be looking forward for that. I mean, if we can organize that program, that will be really great. And as mentioned by Dr. Chopra, so many suggestions have been given by him to us, and we will take this all this knowledge which has imparted to us. We'll take, and from the scope, I like to assure that the kind of suggestions which you have given to us, I'll be discussing with Somaji also, and we'll be taking this forward. In fact, shortly we are going to have a health committee. We will be forming a health committee of experts from the public sector, and we'll be taking forward. And the suggestions which you have given, we will I mean, discuss those also. And I'll request all the participant attendees also to give us their ideas what more can be done by scope, so that we don't restrict only to the what you call public sector, but take it to the masses and take it to the society. As he used the right word, that let us be the warrior in this particular field, and let the scope come at the front. And your guidance and your support will always be there, Dr. Chopra, in this regard. And Famhealth, definitely, I mean, it's a great occasion for us to be associated with Famhealth, and program has been very well conducted. I am sure that we will have many more partnerships in the future also to take this forward. Last point I like to say that this time will also pass, as Dr. Chopra mentioned. Then the only thing we have to remain united and together. So please stay together and stay safe. Thank you. Thank you very much.
Vishal,
Thank you
what are
so
things?
much. Thank you so much, Mr. Kopi. Thank you so much for your kind words. Now, next I would like to extend the stage to Ms. Asha Kapoor, who's the Managing Director of Famhealth, to give her vote of thanks for the beautiful session organized between Famhealth and Scope. Asha ji, please go ahead.
Maji, you like to say something?
Can't hear.
Can't hear your audio, ma'am.
Yes, only one point I wanted to add to Chopra's request for vaccination. All the CPSCs are taking active part in the vaccination program of the country, and we are vaccinating not only our employees, our contractual laborers, their families, and also anybody who is associated with them. So the directive has already been given to the CPSCs. The CPSCs are wholeheartedly supporting this action, and I think all of us are taking care. We are all organizing the vaccines. So I think, in a we would be more in a more advanced stage of vaccination the country would be.
Sure.
Thank you.
Thank you so much. Thank you, ma'am. Asha, please come on stage and say a few words.
Thanks. It's such a privilege and such an honor. And as the founder and managing director, I can only thank all of you. In fact, we at Famhealth are so committed to getting accurate information, which is health information. And I cannot thank you enough, Dr. H.K. Chopra, sir, for spending so generously your time on a Sunday. I think iski to daad deni padegi, sir. Thank you very much, and our deepest appreciation to Scope, who even provided a platform at all. Ma'am, Soa ji, Atul ji, Director General, you are of course chairperson, ma'am, of Scope and of SAIL. I think this has been so fabulous, and Mr. Sopte, I must point out that one of the things that I've seen over our interaction with Scope over the last one year or so is the amount of commitment to health, as I'm sure, no doubt, other initiatives, but the commitment to health you have displayed. Thank you very much. We should stand shoulder to shoulder along with you. We'd be happy to be your associates all the time. I'm not going to extend it this vote of thanks more because it is 1 hour out. This is a good time to talk about, give thanks to Mr. Khan. Mr. Khan is the one who helped this initiative along with us, and his team, who has been so fabulous. Thank you, Shubhratna ji, Samriddhi, Lippy, Naushad, Adil, and whoever else whose name I may have missed out. And thank you all the participants who listened to this webinar. I think this was fantastic. And I took out so much out of this. I was riveted all the time. Thank you to all the participants and all the sharers. So privileged to be here. Thank you for inviting us so much. And we too, along with you, Scope, would be honored to take it on all the platforms globally and locally that we're involved with. We do run a TV channel with Tata Sky on health, and we will ensure that we get adequate coverage. Thank you so much. That's a pledge. Thank you.
Thank you.
Thank you.
Thank all the stalwarts once again. Thank you for being with us, and everyone, please stay safe. And we now conclude this session. Thank you very much.
Thank you, sir. Thank you. Thank you, Sopte sir. Thank you very much. Thank you. Thank you, Asha ji. Thank you, Vishali.
You were
God bless you.
fantastic.
We enjoyed. We enjoyed. Everything was so good.